I'm Dr. Arielle Klepper. I'm a physician scientist and an assistant professor of medicine in the Division of Gastroenterology and Hepatology at the University of California, San Francisco. My clinical focus is working with patients who have alcohol-associated liver disease. Alcohol-associated liver disease is really two diseases. It's liver disease and alcohol use disorder. And thinking about the comprehensive care for this vulnerable population really involves tackling both of those things and doing it comprehensively. Dr. Courtney Sherman, a transplant hepatologist at UCSF, was really thoughtful about trying to find innovative ways to approach this challenge and brought to UCSF the Healing Alcohol-Associated Liver Disease Together, or HALT clinic, to serve a multidisciplinary approach in this population. As a provider with the opportunity to work in this clinic, it really allows me to not just focus on the liver disease and care for these patients from that point of view, but also to learn from addiction medicine providers treating alcohol use disorder, from counselors about substance use recovery. And these integrative and multidisciplinary care models are really a thoughtful approach to working to care for this vulnerable and underserved population. We know that patients with advanced liver disease develop infections at a much higher rate than the general population. What's challenging about this is we don't always understand why this happens. And in some cases, we can't even figure out what infections are causing inflammation in our patients. And so my research goal is to really start to understand this what and why. We're working with sequencing techniques that are really at the cutting edge to apply deep sequencing to identify what infections are really impacting our patients, and a goal of trying to understand why these infections are happening at a higher rate. And it's really the approach of trying to answer this what and why in the patients I care for that's my long-term goal. I hope these findings can help to advance patient care and lead to more targeted therapeutics and really improve the way that we can care for our patients. I'm most excited in my job and in my day-to-day life about the possibility of discovery. As a physician scientist, that's really an arc. So discovery can be at the bench where we get to apply scientific techniques and make new discoveries and learn from the biology of disease. And it can be at the clinic, learning from our patients, getting their stories, trying to learn about the boundaries and the amazing things they've overcome. And really being able to connect this arc, taking something from the bench and applying it to the bedside, is the possibility and discovery that exists every day that makes this job exciting and rewarding. Being named a Watson Scholar is an immense privilege and honor. I reflected on this in a couple different ways. I think one of which is how special it is to be at UCSF, to be at a place with a mission to really promote the work of either physicians and scientists who are underrepresented historically, or to advance the work for patients who are in vulnerable and underserved populations. This institutional mission and this commitment to working to develop diversity and thoughtful models of care is a really special thing about being at UCSF. And I believe investment in this area is really important to innovation. I think targeting these approaches is how we're going to best grow as a clinical and scientific community. And so being the beneficiary of that is really a special thing. I also think that the prior Watson awardees are such inspiring people. My current cohort is full of amazing work that's motivating and inspiring. And being a part of that is a tremendous privilege. So using both of those opportunities, my goal is really to build a research agenda that aligns with all these missions to try and push forward innovation and do it in a way that's focused on providing care for vulnerable and underserved populations to maximize the care we can deliver and to really push innovation forward. So as someone who identifies as historically underrepresented in science and medicine, I recognize this privilege and I'm very grateful for the opportunity and hope to grow and learn from the examples set before me.